terms of child exploitation, during this pandemic, some of the parents have lost their jobs. Hence, making children help their parents provide basic needs. The girl child has been forced to engage in sex for payments. This has caused early marriages. Some of the girls have aborted, hence causing death, while some have given birth. What will happen to those who have given birth? What will happen to their children?
We as persons with disabilities have learned to adapt and be resilient during this period. COVID-19 came with immediate measures to curb the situation, which included washing of hands, use of sanitizers, social distancing, wearing of face masks, ban of social activities, including church services. How I, as a visually impaired person, can wash my hands according to the prescription. Many of us complement our daily life activities with personal assistance and support. And this became a big problem as we were afraid of them and they of us.
COVID-19 has been a challenge because sometimes because of a health protocol, people need to wear face mask. And this is a barrier for that people because we need to read lips.
Yes.
So this is okay. It's part of what we're living now. But here's an example of how we can think outside the box.
All right.
And so it's the same with the church and society. We're thinking good, but we need to go a step further.
Like this time of COVID-19, a lot of things which is going on. People, they are struggling. People, they have lost job because of this COVID-19. So mental health here in Zambia does really affect a lot of people, a lot of youths. People have no job.
The COVID-19 has influenced very much to the appearance of the conflict in Belarus in August of this year, because in my country the government was ignoring the problem of COVID, and so it was given false information about the disease and not providing enough medical help and hiding the numbers, and so the society became very politicized because of this, and had a lot of protests against the government. And at the elections which we had in August, people tried to elect a new president. And since that moment, the big conflict started. During this conflict, 20,000 people already since August were arrested and detained.
In our local context here, we often say it is very difficult to face a war in two fronts. And within Cameroon now, that is the kind of battle we're going through, where we see government resources is being split into either handling the crisis or trying to handle the pandemic, where we see even the humanitarian needs in the country now has to be divided. There are people who have been suffering as a result of numerous lockdowns as caused by the COVID-19.
We saw increasing amounts of threats, violence against women, violence against girls, and a general speech of denial of our government before the situation of human rights.
Not only death itself means death. Losing one's perspective, dreams, and hopes also mean death. And if you don't pay attention, people will start dying despite being alive. Besides physical death, we have to discuss issues such as the death of hope in the future.
to this online event, this webinar on COVID-19, Reading the Signs of Our Times. I welcome you on behalf of the World Council of Churches and its many ecumenical partners around the world that have joined in presenting this initiative, and also in presenting a global week of prayer that will take place next week. So welcome once again to this event, which also marks just over a year since the global pandemic was declared by the World Health Organization. It's a sobering anniversary that we have marked in recent days. Let's first now listen to a message from the Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus.
Excellencies, distinguished guests, dear colleagues and friends. In times of crisis, faith is a source of support, comfort, and guidance for billions of people, particularly those in vulnerable situations. Faith-based health service providers also play a critical role in many countries in supporting national responses to the pandemic. Communities of faith can play an important role in sharing information from public health authorities and in countering the misinformation about COVID-19. This can not only help stop the spread of the disease, but also reduce fear and stigma and provide reassurance to communities. I know that because of the pandemic, many faith communities have not been able to meet as you would normally, and you have had to find new ways to connect to your congregations and communities. I'm very grateful for the support that so many faith communities around the world have provided for their own members and beyond. Equity is a central principle in many faith traditions, and we count on your support to promote equitable access to vaccines globally. I will be co-hosting a roundtable dialogue on vaccine access, equity, and acceptance with religious and faith leaders on the 19th of March. And I look forward to strengthening our engagement with faith communities during this pandemic and in the future. May the week of prayer bring renewed strength and resolve for you and your work. I thank you.
We thank Dr. Tedros for this very encouraging message. Now I would like to invite the Deputy General Secretary of the World Council of Churches, Dr. Isabel Apao-Piri, for a brief statement. Dr. Piri.
Thank you, Peter. Your Excellencies, distinguished guests, Your Eminences, colleagues and friends, on behalf of the World Council of Churches Acting General Secretary, Reverend Professor Dr. Yuan Sauka, I have the privilege to welcome you all to this webinar on COVID-19, Reading the Signs of Our Times. 11th March 2021 marked 1 year since the World Health Organization declared the novel coronavirus COVID-19 a global pandemic. 1 year has passed, and according to WHO data, there have been over 1.9 million confirmed cases with more than 2.4 million deaths. Because of this pandemic, countries have had to grapple with the resulting crises which have impacted all areas of human condition: physical, mental, spiritual, economic, and environmental. This webinar will present up-to-date information on COVID-19 pandemic and its impacts for the purposes of reading the signs of our times, according to Matthew 16, verse 3, in the context of the pandemic as a means of social analysis. The COVID-19 pandemic has reached all regions of our planet. It has made manifest the danger of the ceaseless commodification of creation. It has revealed our unexpected vulnerability and interdependence. There's fear and panic, pain and suffering, doubt and misinformation about the virus, the vaccine and our responses as Christians. Yet, as a global community of faith, we affirm that even amidst our vulnerability, we trust in God, as God is our hope. We are called to give account of our living hope through the resurrection of our Lord Jesus Christ. We are called to show that another reality is possible, that even the landscapes can change. Therefore, we continue our pilgrimage of justice and peace. We hope that God's Spirit will give us the strength and the wisdom to find our way as we continue to walk, pray, work together for the healing of the nations. In a time of overwhelming change, it would have been very easy for faith communities and individuals to feel lonely and overwhelmed. But the voices of the global fellowship of believers were not silenced and provided hope and encouragement. Very early in the pandemic, on 18th March 2020, a pastoral letter was published by the World Council of Churches, and I quote, "Faith communities can, in times like these, do a lot to promote solidarity and accountability, wisdom and care. We, as churches, can and should raise the voice of the communities who are made vulnerable by their marginalization. We do not have sufficient water to drink, let alone for washing their hands. We have to consider the displaced communities due to war, famine, economic and ecological collapse, living in their precarious conditions, many of them not even recognized by authorities of their countries in which they find themselves. They cannot be left completely defenseless against the pandemic. We have to be in solidarity with those for whom self-isolation means a loss of livelihood and even the risk of starvation, and with those who precarious daily life leaves very few options for social distancing," end of quote. 1 year later, the webinar will provide brief information on the current status of the pandemic and on related issues, including vaccines and vaccination programs, the situation of frontline health workers and services, the wider social and economic consequences, and the special impact on children and youth. It will also present an introduction and overview of the Week of Prayer program, 22 to 27 March. I thank you.
Thank you very much, Dr. Piri. And now for that updated information on the current status of the pandemic and the response, I'd like to turn to Ms. Sarah Hess from the WHO's Information Network for Epidemics to provide a short report. Sarah, over to you.
Thank you very much, Peter. I will just share my screen as I have a presentation. So I hope that everybody can see that. Thank you, Peter, for the introduction, and thank you, colleagues and friends, for the invitation to be here at this very important event. It really is an honor. Just as many people have alluded to, we are just past the year mark where the outbreak was officially declared a pandemic, and that is a sobering time. And so I thought briefly for the beginning part of my presentation, I would take us back a little bit and have a retrospective look at how this pandemic has evolved, highlighting some of the key issues over the past year and taking us forward to where we stand to date. So I think artificially we can carve out the last year into 5 phases, taking us through from when this unknown virus emerged in Wuhan, China, right through the unfolding of the pandemic, the acceleration, and right up until where we are today, where the focus is very much on vaccines and the development and distribution of medical countermeasures. So for stage 1, this was really in the beginning, the first 2 or 3 months of the year 2020. The first cases of this unknown pneumonia were reported to WHO on the 31st of December, and it was on the 1st of January that we convened our incident management team. And for those that don't know, this is a team that's convened every time there is an emergency or an outbreak to decide and discuss how to best approach the response. And so this team convened on the 1st of January in 2020. Significantly, the 12th of January was when China shared the sequence of the novel coronavirus. And this is very significant because it enabled researchers around the world to have access to the genetic sequence of the virus and start the research and development on vaccines. And so it's really unprecedented that this research happened and started so quickly in the outbreak. All eyes were on China, obviously, for that first month. And it was at the end of January that WHO declared a public health emergency of international concern. It was also in February that a global research and innovation forum was convened, and it was really at this point that the diagnostics, the therapeutics, and the vaccine research globally began in earnest. As we've alluded to, 11th of March, it was declared as a pandemic. At this time as well, Europe was described as the epicenter. So 3 short months, but the world really was on its knees and in awe as we watched this outbreak move from China into the rest of the world. So which leads us into stage 2, and this was when the COVID-19 spread outside of China. There were a couple of countries that were severely impacted immediately. We had Italy, Korea, Iran, I believe, where there were hugely significant outbreaks. It was during this stage, and I would say that this was the second quarter of 2020, that community transmission was widespread in many countries of the world. We also saw widespread implementation of what we call these public health and social measures. So these include everything from the travel-related restrictions to all the hand hygiene, the social distancing, the cleaning, etc. And during this stage, it was really became apparent that health systems were not prepared for an event of this scale. So in many countries, routine care was disrupted or suspended, and we saw health workers significantly impacted. There was some data that came by, submitted to WHO, and by October 2020, we knew that 14% of all COVID-19 cases were among healthcare workers, which is a very significant number. Stage 3 of the pandemic was really the acceleration, where the epicenter moved from Europe into the Americas. During this phase, we saw, and it became more and more apparent, that beyond just the health crisis, this was an event that was impacting all of society. So this little map on the left-hand side shows us the change in international tourist arrivals on the different continents. It compares 2019 with 2020, and you can see that in the majority of continents there is more than 50% decrease in international tourism in these continents, so significant impacts. It was also during this third stage towards the middle of the year where we realized and had more understanding on how COVID-19 is transmitted, and crowded places, close contact settings, and confined enclosed spaces are really high risk for transmission, and this knowledge and understanding really drives some of these restrictions and public health measures. As we move towards the end of the year, it really becomes a multifaceted pandemic. So we see some countries where there is sustained transmission, other countries where they have managed to control the outbreaks and are COVID-free, and then Europe again was entering a second wave of the pandemic. It was also during this time towards the end of the year that the global partnerships began to rise in interest and importance. And one of these is the ACT Accelerator, which is a global collaboration that is convened by a number of partners, including the WHO. And the purpose of the ACT Accelerator was to really accelerate, as its name suggests, the development, the production, and the fair and equitable distribution of COVID vaccines, diagnostics, and therapeutics, bringing together a wide range of stakeholders. So in order to do this, the ACT Accelerator had a business investment case of about $31 billion US. I mean, interestingly, the amount of money that they estimated to achieve the goals of bringing these interventions to the world really was found that if they managed to do that in time, it would save a significant amount of money that would be lost through the economic impacts of a prolonged pandemic. And so I've just put in a little bracket at the bottom of the slide that as of today, actually, there is still a gap in this investment case, and we still in need of about 22 billion in order to achieve those goals. So despite significant progress and a lot of contributions from different countries and entities, there is still a shortfall. So stage 5 was really about vaccines and global calls for solidarity. Vaccines began to be rolled out at the beginning of this year, but this was accompanied by lots of concerns around the emerging variants and around access and equity. Linked to this, of course, was this, we saw a huge rise in mis and disinformation, made, of course, all the more easy by this, the interconnectedness and the access to social media. And this mis and disinformation has done significant damage and erodes trust in many countries. And it's something that we're working hard at the World Health Organization to try and counter and manage. So where are we today? I think has been alluded to, we are in excess of 119 million cases and unfortunately more than 2.6 million deaths. There really isn't a country in the world that isn't impacted. And these graphs just kind of give us a snapshot of the cases in the past weeks. We still see that the Americas and Europe, now India as well, are severely affected. A little update on the vaccine rollout. As of the 14th of March, more than 350 million doses have been administered. This data shows the countries that are succeeding to vaccinate large proportions of their populations. And while these are really incredible success stories, we all know that the vaccine rollout is inequitable, and there are many countries in the world that are not even managing to vaccinate priority populations. And so I thought it might just be important to reiterate from WHO's perspective, the public health approach to vaccine allocation, what we really are advocating for with vaccine allocation and distribution, because we know that there are limited supplies. we're not going to be able to manufacture enough vaccines in enough time for everybody in the world to have access immediately. And that's why we recommend prioritization and the vaccination of certain risk groups, such as older adults and persons with underlying conditions. And really the objective from this public health approach is to make sure that we are alleviating the impact on the health systems, and we are reducing mortality and morbidity. And so it's with this approach in mind that we really need to move away from what our Director General has called quite often vaccine nationalism, knowing that all countries everywhere need to have access to vaccines. I think some of the other things that are really becoming of critical importance now is the economic impact. The longer the pandemic goes on, the more severe these are going to be. This was just some analysis done by the World Bank Group. Significantly, they estimated that between 88 and 115 million people might be pushed into extreme poverty this year, which is very sobering. And I'm almost at an end, but I just wanted to reiterate that, and many others will speak to this, I'm sure, but the vulnerable and affected communities, the impact is much greater on these communities. And so looking at informal workers, people in closed setting, existing emergencies, young people, I'm sure my colleague at UNICEF will speak to this, but the disruption in education has been huge. Healthcare workers we've seen, and then of course refugees, migrants. And just I looked into the data on the gender-based violence, and I looked at reports from different countries where it showed up to an increase of over 100% in emergency calls during lockdown, which is difficult to even imagine. And I just wanted to reiterate what my Director General said in his opening remarks about the critical role of faith communities in this response. We really want to acknowledge that in this global crisis, where there is so much uncertainty, illness, and fear, the wide-reaching impact of faith communities, not just in the spiritual support that they provide for people, but increasing social cohesion, managing the significant impacts on mental health, stigma, and caring for the most vulnerable. I've mentioned the communication around misinformation, disinformation, but then even more broadly, the delivery of services, supporting national health systems. And so again, just on, as my WHO voice really, and on a personal note as well, it's a very significant impact, and one that we really are most grateful for and would like to acknowledge. And with that, I will stop, and I'm sorry if I went over time, but thank you for the opportunity.
No, thank you very much for this very substantive report, Sarah. That was great. You referred to Dr. Tedros's message, and I was going to remark on that as well, that he had lifted up the different ways in which faith and faith leaders around the world are important in the context of the response to the COVID-19 pandemic. In fact, we have a very short video now that hopefully will serve to highlight the significance of these roles. Cue the video.
Yo hago un superhéroe a mi líder porque ellos son los que en este momento nos están ayudando.
The role of a church leader in this time of the COVID-19 pandemic, so they can also help in the fight against the spread of the pandemic. I want them to continue to pray and talk to their followers that COVID-19 is real, as some still doubt.
My church leader has gone ahead to advocate for our rights during this period of COVID-19. He has also added a voice on how to avoid COVID-19. He has sensitized people about the do's and the don'ts during this period of COVID-19. My church leader has really been a superhero.
Cette rencontre qui nous renforce, nous rend capable de mieux accompagner aussi toutes ces personnes qui nous côtoient, avec qui nous travaillons, nous vivons et voilà, que nous rencontrons.
Por mi parte y en conjunto con la Iglesia, hemos procurado mantener durante este tiempo de pandemia, mantener los vínculos con las comunidades más vulnerables, no solamente mantenerlas, sino extenderlas a otros sectores. Lo hacemos ejecutando o seguimos ejecutando jornadas sociales que tengan que ver con comedores, provisión de alimentos, impartición de talleres de ayuda psicoemocional y de bienestar emocional para todas las personas. Tratamos de educar, de incluir, de fortalecer los principios de dignidad que suelen ser perdidos a través de estas situaciones adversas. Influimos incluso acerca del COVID-19.
God is in the midst of this, and I believe that He is moving to bring us together, not only as a family of God, but the people of God throughout this globe.
Thank you indeed. And now, to delve a little bit deeper into some of the many dimensions of the pandemic and its impacts that we've already heard named, we have a splendid panel of 6 experts, including Ms. Aisling Falconer, Education Specialist from UNICEF, Ms. Vuyelwa, or V. Chitimbere, who is Executive Director of the Zimbabwe Association of Church-Related Hospitals, Mr. Andrew Weilman, Assistant Director, Older People's Care at the Salvation Army in the UK and Ireland, Dr. David Bowen, Director of the Relief and Development Coordinating Center at World Evangelical Alliance, Reverend Cesar Garcia, General Secretary of the Mennonite World Conference, and Reverend Andrew Morley, CEO of World Vision International. So I'm going to go straight to those speakers and ask Aisling first about the fact that UNICEF has recently released quite a substantial report on COVID-19 and school closures, highlighting the effects on children and young people of a year of education disruption. Could you give us some highlights, or should I say lowlights, of that report and its conclusions?
Yes, no problem. And thank you very much, Peter. Thank you to the World Council of Churches for inviting us to have this opportunity to speak of the effects of education and COVID. And as you said, my name is Aisling. I've been an education specialist with UNICEF since 2008, and I'm just going to talk you through a little bit about the main impacts of this disruption in children. So despite overwhelming evidence of the impacts of school closures on children, and despite increasing evidence that schools aren't the driver of pandemics, as we all know, many countries have opted to keep their schools closed for over a year. Schools for more than 168 million children globally have been completely closed for this time, according to the new report that you've just mentioned from UNICEF. As we enter the second year of the COVID pandemic, UNICEF believes that no effort should be spared to keep schools open or to prioritize them in the reopening processes. Because with every day that goes by, children are following further behind. And as we've mentioned before in various different speakers, the most vulnerable are paying the heaviest price. So school closures have devastating consequences on marginalized children, and all children, but particularly marginalized children. Children's ability to read and write and do basic maths has suffered, as is the development of their basic skills, which they require to reach their potential. There's emerging evidence that not only is learning being stalled, but there's been a regression in basic skills acquisition. Even before COVID, more than half of 10-year-olds in low and middle income countries couldn't understand a simple story. So you can understand what the situation would be like now after over 1 year of school closures. Beyond learning, schools provide children with health, immunization, and nutrition services, and also a safe and protective learning environment. Without school meals, children are being left hungry, their nutrition's worsening. Without daily interactions with their peers, there's a reduction in mobility, they're losing physical fitness, and they're showing signs of mental distress. Without the safety net that school provides, and I think we saw in our opening video, children are more vulnerable to abuse, child marriage, and all different forms of child labor. The longer children remain out of school, and other health pandemics have shown, or health emergencies have shown this, that children are less likely to return to school. And it has been predicted that over 24 million children and youth might drop out of school due to COVID. This is something and a substantial number that we have not seen in our lifetime. So what can we do about it? I'm just going to present very quickly 3 or 4 things that UNICEF is advertising or is promoting as part of the recovery package in education. The first thing we need to do is to get all children back in school. We need to proactively target girls and the most marginalized children to get them back into learning. The second thing we need to do is to get children back on track with their learning. So that's by providing targeted remedial and catch-up programs to minimize the effects of the learning loss that they've encountered for the past year. The third thing, and it's looking at education from its holistic point of view, and look at comprehensive support through mental and physical psychosocial support to improve using education as an entry point for nutrition and for protection so that children are in their safe learning environments. We also need to invest in people, technology, and in teachers. Teachers are one of the most important people that we need to look at in the recovery process and getting children back to school. So that's it from my side. I've tried to do it very quickly in a snapshot of the global education support, and I look forward to hearing the rest of the panel and how COVID has affected different categories of people. Thank you very much, Aisling. That's great. And I know that some of the other speakers will be wanting to pick up on some of the themes that you've raised in what you've just said. Thank you very much for your presentation and all the work that you and your UNICEF colleagues are doing in this domain. V, let me turn to you. Of course, we know that health services have been hit very hard during the pandemic, and in some cases overwhelmed by the additional caseload of COVID infections. Could you tell us a little bit about what sort of impact has this had on health services and health workers in your country, in Zimbabwe?
Thank you very much, and hi everybody. I think when COVID hit us, we were all unprepared and we didn't know how to respond to that. And as a head of an organization, we support Mission Rural Hospitals. I found myself as a leader and also as a health professional to actually remain focused, and people expected us to be on top of the situation. And also we expected to show confidence so that we can gain trust of the people on the ground about the COVID disease. And also we were actually expected to provide accurate and updated information and also make quick decision and informed decision to protect the general public as well as the workforce for their safety and also for them to continue providing the required services. The major problem which we had also was that there was not a constant provision and flow of appropriate resources, including PPP and other related commodities. And we also expected to actually provide a conducive and safe environment. So from my general observation, I noted that the pandemic had shifted mindsets of health workers around work ethics, stress, risks around COVID. As the virus was fast spreading, killing millions, we're told that it's mutating and also increasing challenges for scientists and health professionals to contain and manage the disease. So for me as a health worker leading other health workers, we are all struck by fear. Fear of our own infection risk and fear of infecting others, and then also fear of death. This is when we started valuing our life and reflecting in terms of the value of life. And now trying to put our heads together to say how best can we deal with this situation. As already mentioned, there was an issue of stigma as people thought health workers were carriers and spreaders of the virus as they were actually dealing with people who were infected. And also occupational exposure, as I've mentioned, and then also the lockdowns, particularly for the health workers, we thought they were superheroes but also the lockdowns affected and made them worry about their families in terms of exposure and risk. And also they were worried that when they are going to work, they're using public transport where every Jack and Jill was in, and they could get infected and make their situation work. And also they were worried about juggling work and home affairs, and also looking at their finances and risk allowances, because there was no insurance that they could be properly protected. So we forgot that health workers are also humans. They had their own frustrations, particularly in the rural setting, where issues of equity and access were a problem. And also we noted that poverty was a major driver of COVID because of economic issues, where people could not afford to stay at home and they had to survive. And after all, we also noted that there was no support in terms of mental and psychosocial support. Health workers were fearful, depressed, and had burnout in terms of service provision. However, with that, we also looked at the governance structures in terms of communication and collaboration, supply chain and vaccine efficacy, and vaccine hesitance and regulatory issues. Currently, most of our health workers, even the population at large, are hesitating to have themselves vaccinated because they still don't have trust in terms of the vaccines, because they are getting all sorts of information, which is some of it is toxic and does not help in solving the situation. So also in Zimbabwe, we are closer to South Africa, and also our people are cross borders for economic gains. And we find that the new variant, which has been identified in South Africa, is also causing problems to say what vaccine is appropriate to deal with this new variant. And also worried about the domino effect across neighboring countries and so forth. So as we are planning, we totally forgot to look at the welfare of the health worker and to make sure that they are properly supported and making sure that their fears are laid so that at least they can provide services with confidence, and also that people can trust them. So currently we are lacking trust, and our health workers are not 100% confident. Thank you.
Thank you very much, V, for giving a very, very clear insight into the situation of health workers in Zimbabwe in this context. Please do convey our warm solidarity and support to all your colleagues in that sector in Zimbabwe. Now we turn to Andrew Weilman. We have two Andrews on the call. So Andrew Weilman, I want to invite your comments on the following question. The elderly are, as we all know, one of the groups most at risk from this virus. But in addition to the risk of more serious effects of infection, the elderly have been affected in other ways as well, haven't they? Could you tell us a little bit about the different dimensions of the pandemic's impacts from the point of view of elderly people with whom you work?
Yes, thank you very much, and good afternoon, Peter, and good afternoon, everyone on the call. And it's great to be with you, and thank you for the opportunity to speak with you this afternoon. As Peter quite rightly says, in the past 12 months, no group has been more vulnerable to COVID-19 than the older community. And although the immediate concern for this group remains mortality, the COVID-19 virus has hit the fast forward button on aging for millions of older people across the UK and in the world. In April 2020, at the height of the first wave of the virus in the UK, 1 in 8 people over the age of 90 died of COVID-19. Fear of the virus, an aggressive acceleration of loss in mental and physical capacity, loneliness and isolation, and an inability to grieve as normal for those that they have lost, lay the ground for a potential public health emergency. Today in the United Kingdom, 1 in every 12 people in the UK is aged 75 or over. And by 2040, this number is expected to nearly double to 1 in 7, with similar numbers expected for many other people, in particular countries around Western Europe. Of course, this is a very diverse group, no two older people are the same. Some older people are very active, mobile, and still working. Older people are unique individuals who, during this pandemic, will each benefit from support, kindness, and support that is carefully weighed and tailored to them. Of course, we know the Bible gives us a higher view of older people, but by contrast, our society in our modern world often sees old age as a negative thing. And much of the discourse, much of the conversation, much of the social media that we heard about earlier in the call has only increased ageism over time. The World Health Organization's framework of active aging has the goal of ensuring that older people remain a resource to their families, communities, and economies. I call upon us all this afternoon to challenge the narrative of ageism. We have seen marvelous intergenerational acts of visitation, practical service, and grasping new online and technology-based solutions to ministering with older people, both in residential care and community settings. The Salvation Army's 13 care homes in the United Kingdom and our 500 staff, despite facing extraordinary challenges during this past 12 to 18 months, have seen the resolution of older people coming together, communities coming together around those networks, and we have been grateful for the support and ministry that has been offered. But most importantly, our talk must match our walk in how we value the dignity of each human life and how we recognize the contribution that all ages can make. We should resist making easy or dismissive generalizations about older people. They are a diverse group, inside or outside our churches. Before the COVID crisis, tackling isolation and loneliness in our society were key priorities in our own work with older people. The danger is even more significant now. Our aging population means that by the number of older people who are chronically lonely is projected to increase in the UK to 2 million by 2025. And while wider society will focus on life returning to normal for those able and willing to go out, perhaps churches will be required to model listening for the voice of the shielding, even as their usual ministry may resume. And we call on all our churches, where possible, to actively recruit staff or volunteers to represent this perspective for as long as necessary. Our older peoples our older communities, should I say, are in a state of uncertainty and fear. But we have a great opportunity for ministry to speak in terms of hope and confidence in God through this season. Fear is a psychological, emotional, and spiritual battle. And we have the opportunity on this call, on this webinar, on our world and global ministries to offer comfort and hope. Thank you.
Thank you very much, Andrew. You've been an admirable guide for us beyond the medical facts regarding the impact of the pandemic on elderly people to a much broader frame of reference for that discussion. Thank you very much. I knew you would be a good guide for us in that regard. Next, I turn to David, because some of the things that Andrew has just said also relate to what I'm expecting to hear from you. Your particular expertise is in the field of mental health. Now, we are beginning to hear more and more about a tidal wave of mental health consequences from the pandemic, some of which we heard alluded to in what Andrew has just shared. But I'm going to ask you to reflect on that, particularly from the perspective of children and young people, again, which we've begun to hear about in what Aisling had to say on the education issue. But how do you assess this dimension, David?
Yes, thank you, Peter. And it's my pleasure to be with you today from the World Evangelical Alliance. I want to briefly describe to you what I call the tip of the mental health iceberg, in that it has only really just begun to show itself. And I want to comment on some different examples and ways in which people are being impacted. First of all, regarding child and family mental health, there have been some heart-rending reports in the media regarding adolescent suicide. But as a start, I think it's important to note that stress alone does not make people suicidal. But stress together with isolation will exacerbate existing problems such as mental health and substance abuse. In addition, children and families are facing a variety of losses. There is the economic loss, there's the social loss, especially where there are lockdowns. There's educational loss as school attendance is disrupted. There are spiritual losses and more. And these losses compound the impact of the pandemic and further will complicate recovery as resources are needed to help people to recover. So while the evidence of COVID's impact on mental health is still unfolding, clearly there is a rise in anxiety and depression among youth. And so it's very important that monitoring and prevention strategies are put in place and that we do so now. For example, we need resilience building strategies that mitigate these losses, that maintain social support and social connections, and strengthen access to resources. In a bit of a different area, I also want to comment on neurological impact, and some of this is related to what Andrew was just noting. But we are seeing that people who are hospitalized with moderate to severe cases of COVID are also experiencing a range of neurological, cognitive, and psychological symptoms. This was in fact seen in the 1918 pandemic. There was a surge in neurological problems together with that pandemic. And it's important to note that many of those unfolded gradually and were seen in many cases months and even years after the pandemic ended. And so we need to be aware of this because there's going to be an impact on people that will be with us for some period of time. I also want to comment on it from a community health perspective. Some people who feel vulnerable to and fearful of disease become more xenophobic. When people are worried about infectious diseases, they respond more negatively to people whose physical appearance is different or may appear unusual in some ways, such as people with physical disfigurements or people with physical disabilities. And it results not only in increasing prejudice, but in some cases, even a more violent reaction. Fearful people who feel vulnerable to disease, for example, will show preference to immigrants who are like themselves and a more negative response to immigrants who are dissimilar, even to the extent of preferring to exclude people from countries very different from the host country. And as I said, in extreme cases, this can even lead to physical acting out, as sadly we have seen in news reports of attacks against Asian people. Which brings me to a final comment on the role of our faith community. As I mentioned, among the losses is also a spiritual loss. And that right at a time when some people are grappling with the issue of meaning. How do I make sense out of this? How do I understand this? Connecting to the faith community is a very important element of processing these issues of meaning, and can also be very important in terms of assisting people with the broader mental health impacts, the fear and anxiety that people are developing. Our challenge is to find creative ways to maintain this connectedness, to maintain those strong connections with our faith community and with supportive peer support. So this is an important role for a faith community, helping us to overcome some of the isolation, helping people to find ways to be resilient to the pandemic. And these are roles that we see the faith community playing out in a variety of ways, providing relief, for example, assisting people in understanding the nature of the disease, understanding the public health strategies, maintaining their faith traditions. All of these are really critical in helping people to cope through this global disaster. So thank you, Peter, for the opportunity to provide these comments.
Thank you very much, David. Now, I just want to acknowledge that we are running a little bit over the advertised hour, and I do hope that both our speakers and our audience will bear with us due to the slightly late start of the webinar. I apologize for that. But David, you've built a fantastic bridge between the previous speakers and to the next speaker, Cesar Garcia, because you've ended with reference to the role of religious leaders or faith in particular in this context in addressing the challenges of the losses and the mental health consequences of the pandemic. So now, Cesar, as a religious leader yourself, you are dealing not only with the role of religious leaders and organizations in the response to the pandemic, but also the ways in which religious communities have themselves been affected, and the ways in which religious communities seek to understand the meaning of this crisis. So what conclusions, at least tentatively, can you offer?
Thank you, Peter, and thank you for this opportunity of sharing with all of you. Well, you know, thinking about our reality, even before of the pandemic, we were facing already forces of death. We can call these kind of forces, again, even before of the pandemic, those movements that were increasing around the world, related to injustice, nationalisms, polarization, fragmentation, division, inequalities, many of them pushing many societies into more violence. So these forces of death that were already going on before the pandemic were affecting our churches too. So we saw in our own religious communities, local congregations dealing with polarization too and fragmentation, national churches dealing with a tendency to go into division. So in that context, the pandemic arrived. And as we have heard during this webinar, thanks to God, many of these congregations and churches have been able to respond with compassion. They have been able to put the need of others over their own need. And in that way, becoming a community of hope, embodying hope in many social contexts. So I will say that thinking about what David mentioned, as followers of Christ, this idea of looking for meaning, looking for purpose is again an immense call today. We have this opportunity of becoming communities of hope that live out key values as reconciliation, unity, interdependence, and again, compassion. With this kind of life, living out these values, we can actually invite other people around our communities to act in the same way. If we stay, let's say, slaves of forces of death, like division or fragmentation, there's not a lot of hope to give. If we follow the tendencies of nationalisms, now that we're speaking about inequalities on the distribution of vaccines, there's not a lot of hope. But if we speak out, if we invite others to act with compassion, to put compassion over our own needs, then it's possible to find meaning. Then it's possible to find purpose. And I think as communities of faith, that is an invitation that God is giving us today as followers of Christ. We have this opportunity of living out these values for the well-being of other societies around the world.
Splendid. Thank you very much, Cesar. Just fabulous message of hope on which to conclude your statement. Now, I turn to the last of our panelists in this segment of the webinar. Andrew Morley, you are a religious leader yourself too, but also as CEO of World Vision International, you are obviously heavily engaged in the global humanitarian and development response to the pandemic. You have the privilege of being the last speaker in this panel. So, building on what you've already heard from the other panelists, what would you wish to highlight as additional dimensions of the pandemic's effects and the role of religious leaders and communities in response? Andrew.
Thank you, Peter, and thank you for the opportunity to speak with you today. I've heard such wisdom from the other panelists. I will keep my comments short. I wanted to start with some numbers just to put today's situation into perspective. 85 million more children are at risk of violence as a result of the virus. The pandemic could wipe out 20 years of progress in tackling HIV, TB, and malaria. A record 235 million people could need humanitarian assistance this year. That's an increase of 40% on the previous year. And at least 4 million girls could be forced into child marriage. 4 million additional girls could be forced into child marriage as a result of the virus and as a result of economic issues driven by the virus. So we want to be part of the solution, and we'd love to partner with faith leaders, as we have done in the past, to bring change and to bring the hope that we've just heard from our previous speaker. I'd like to tell a very quick story, and this is a story from the Billy refugee camp in the DRC. And one girl stands out from our work there, and I'll put her details in the chat, but it's this young girl. It's Priscilla. Now, Priscilla, in the camp in the DRC, she's 12 years old, decided that she wanted to bring change. And she decided that she wanted to educate people in that camp as to how to keep them safe, keep themselves safe from the virus. And she wanted us to empower her. She wanted us to amplify her voice. So the solution was pretty low tech. It was a megaphone, and she walked around the camp with her megaphone. And so we literally empowered her to amplify her voice. And she shared messages that she'd got from the local health services on how people can keep themselves safe. Hand washing, social distancing, face coverings primarily. And it was just a wonderful image of how we can empower children and youth as part of this challenging situation that we find ourselves in, to be the answer. And a big part of this for me is she was encouraged to do this by her local pastor. And it's the fact that the church can be a force for good in this situation. And we can literally help to bring not just the vaccine to the people, but also the people to the vaccine by helping through the faith leaders to counter disinformation and misinformation that we heard about before. At World Vision, we work with nearly 500,000 faith leaders across the world, operating in 100 countries. And we will continue to mobilize them to make a difference and to bring the change that we want to see, just as we were able to do with partners with Priscilla. And it's crucial that we engage communities, and the way to engage communities is often through their faith leaders and often through their churches. Our work on this was, together with many on this call, was instrumental in bringing a change and health back to nations after Zika and after Ebola. And I pray that we'll be able to do that in this wave too. My final point is this, that as followers of Christ, we are called together to bring the promises that we hear in 1 Corinthians 13, to bring faith, to bring hope, and to be that sign of love that Christ calls us to be in a world that needs us now more than ever. Thank you, Peter.
Thank you very much, Andrew. What a great story to share. Very simple, but very practical in that context. And I think it gives us all inspiration for the challenge that there is something for each one of us to do, regardless of our respective strengths or institutional backgrounds. So I want to thank all the panelists. I think you've done, all of you, a fabulous job in helping us enter into some of the many, many different dimensions of both the challenge that we still face 1 year after the naming of the pandemic, but also of the ways forward, of the practical paths forward. And here in the World Council of Churches, we see prayer as one and an essential one of those practical paths forward. And so I would like to invite the Deputy General Secretary of the World Council of Churches, Dr. Odeia Pedroso Matius, to present an invitation to the Global Week of Prayer that will take place next week and in which many of us will be engaged. Odeia.
Thank you, Peter. I would like to extend to all of you who are following us on YouTube, for instance, to join in 6 days of prayer in time of pandemic. We'll start on 22nd March next week until 27th. Those 6 days were prepared by the World Council of Churches in close cooperation and consultation with partners like the World Mennonite Conference, World Vision, World Evangelical Alliance, Lutheran World Federation, Salvation Army. And in each of those 6 days, we will have a special theme. The first day will be a day of lament in remembrance of the lives lost. And then in the following days, we'll be praying for suffering and hurting communities, especially for the most vulnerable. We'll be praying for leaders as they make decisions, and some of them economic decisions that have impact on the access of the vulnerable to care and vaccination. We'll pray for healing, especially for those who are on the front line of the struggle against the virus. We'll pray for the protection of those who are in need of care and vaccination. And we'll also celebrate with hope those who are getting up and recovering from such a challenging experience. So you are invited to join us in that pilgrimage of prayer in relation to this challenging situation. We are also finally working on a book which will bring together these resources, the ones prepared for this week of prayer, and many other resources, voices from around the world, voices from regional ecumenical organizations, church leaders, resources for prayer, and WCC resources for dealing with the pandemic. It will be a book called Voices of Lament, Hope, and Courage. So you can have more information about that on our website, oecumene.org. Thanks, Peter.
Thank you very much, Odair. Indeed, we warmly invite everybody who prays to join us in prayer during this Global Week of Prayer next week. And as Odair has mentioned, you will find the details on the World Council of Churches website, but also on the websites of many or all of the other partner organizations engaged in this initiative, and that are also represented on this call. So thank you very much, Odair. And I think it's fitting that, having heard and received your invitation, that we should close this event in prayer. And I'm very pleased to invite Selina Falk, member of the WCC Youth Commission, to offer that closing prayer. Selina.
Thank you. Let's pray. Triune God, we know that you hear us when we call upon you. You hear our cries for help. You hear our lament as we call out to you for relief. You know the depth of our despair. You see all and know all. Yet we come in faith, confident that you hear our prayers and that you will answer. We pray for the peoples of the world and the many difficulties faced because of the COVID-19 pandemic. May you give wisdom to all leaders at every level, so that there will be a common determination to alleviate the plights of those who are suffering. May your healing hands be upon those who are sick. May your divine strength be imparted to all who are caring for the ill and dying. May the most vulnerable find the help they need to improve their current state. May children be comforted through the caring presence of parents and adults. May the Church of Christ be a light in the world in these troubled times, so that others will see our good works and give glory to you and praise to you. Hear our prayer this day, and may the Holy Spirit be our constant source of guide in every way. This is our prayer in the name of your Son and our Savior, Jesus Christ. Amen.
Amen. And thank you very much, Selina, and to all of the contributors to this event today, those who spoke, but also those who worked behind the scenes to ensure that we could present this event in the way that we have today. Thank you very, very much. And with that, I bring this webinar to a conclusion, and once again, invite you all to join us in prayer during the week of prayer next week. Thank you very much for your participation and your attendance.